And then our speakers today, we have Mike Gallagher with My Longevity Health Compass, and then we have Caleb with Oak Street Health. And we will bring Mike up first. Mike, take it away.
Thank you, Connie. All right, my name is Mike Gallagher. I am owner of My Longevity Health Compass, and what our organization does is we look to work with older adults to educate them on how to effectively optimize Medicare. And so today I'm going to provide a very high level of the key timelines associated with Medicare. I'm going to talk about the different paths that one may take, and once one understands the timelines associated to enroll in Medicare, which path best aligns with their needs, then that would be the point in time that an individual will want to look at specific insurance company related solutions. So in terms of educating, let me touch on the key timelines associated with Medicare. People are basically eligible for Medicare on the first of the month that they turn age 65. If someone's date of birth happens to fall on the first of the month, then they're actually eligible for Medicare the first of the month prior to the month they turn 65. And with Medicare, people can qualify for Medicare prior to 65 if they've got a disability or a significant chronic condition such as end-stage renal disease or Lou Gehrig's disease. It's possible for people to qualify for Medicare prior to that. With respect to Medicare, there are three key timelines that people may enroll in Medicare. One is called your initial enrollment period. That is a 7-month window that begins 3 months prior to the month one turns 65. It includes the month of their birth that they turn 65 and 3 months after they turn 65, where you may enroll in Medicare Parts A and B during your initial enrollment period. Some people, many people nowadays, elect to work beyond age 65, and they have access to health insurance coverage through their own employment, or maybe they're covered as a dependent through their spouse who is still working. People may delay their enrollment in Medicare, and that's what someone would fall in a special enrollment period. People may delay their enrollment in Medicare without being subject to a late enrollment penalty, as long as they retain credible health insurance coverage through their employer. Once they either retire and lose that credible health insurance coverage, they have up to 6 months to enroll in Medicare without being subject to a late enrollment penalty. And then finally, we have what's called a general enrollment period. For people that chose not to enroll in Medicare during their initial enrollment period or special enrollment period, there's a general enrollment period that occurs every year between January 1st through March 31st, where one may enroll in Medicare. However, depending upon their circumstances and situation, they could potentially be subject to a late enrollment penalty. So those are the three key timelines with Medicare. People can enroll in Medicare through Social Security on the ssa.gov website, and I generally recommend people enroll in Medicare or initiate that 2 to 3 months prior to when they want Medicare to become effective. So this slide that we have here is one that I think provides a good overview of the different paths that people may take with respect to Medicare. First path on the far left column, you'll see Medicare Parts A and B. Part A is hospitalization. With Part A, there's going to be deductibles and co-payments associated with services. And with Part A, one is allowed to see any provider throughout the United States that accepts assignment of benefits from Medicare. For most individuals, Part A is going to be zero premium. That's going to apply to individuals who have worked at least 40 quarters or 10 years during their career and contributed into FICA and Social Security tax. Part A is going to be zero premium. Another component of Medicare is Part B. Part B is medical and physician-related services. Think of it as being predominantly outpatient-related services. And with Part B, there's going to be deductibles and co-insurance. And like Part A, one may select or see any provider throughout the United States that accepts assignment of benefits from Medicare. And with Part B, unlike Part A, Medicare is going to charge a premium for Part B. And that premium starts at $164.90 per month. And that applies to individuals based on their filed income. If they file individually, it's $97,000 or less. And if they file jointly, $194,000 or less. Medicare is going to charge the $164.90. For those people who are high wage earners and earn over that, Medicare is going to charge a greater premium. And in fact, on the reverse side of this sheet that you have is a chart which identifies what one will pay for Part B. And you can see it incrementally increases based on one's filed income. And what Medicare is going to do is they're going to look at your filed income 2 years prior to determine what your Part B premium is going to be for the current year. And if your income increases or decreases during the course of your retirement or being enrolled in Medicare, Medicare will adjust that each year based on the filed income for the 2 years prior. For those individuals who elect to enroll in Medicare Parts A and B, also known as Original Medicare, they will have the opportunity to purchase a Medicare supplement. And a Medicare supplement is offered by private insurance companies, and they're designed to pick up the eligible expenses not covered by Medicare Parts A and B due to the deductibles and co-insurance. The insurance companies will charge a premium for the Medicare supplement, and it's going to vary based on the individual's age as well as what kind of coverage they have. And so as you're evaluating which path makes sense to me, the things that you want to look at if you go down this first path is, do I prefer to choose my own providers? You can do that with Original Medicare. What kind of utilization have I been using? You know, when you assess your own health, a high utilizer, a low utilizer, and what kind of out-of-pocket exposure does one want to be liable for? So there are different plans to help evaluate what one's out-of-pocket exposure is. For people that enroll in Medicare Parts A and B, they will also have the opportunity to enroll in Medicare Part D, which is a prescription drug program. And here in Colorado, there's 22 different plans. And these plans will vary in premium and out-of-pocket costs based on what medications, prescription medications, one is taking. These programs, if one chose not to enroll, they could be subject to a late enrollment penalty. But with these programs, I've seen premiums range from as little as $3.50 a month up to $129 a month. And so the good thing with Part D is that you can change your plan every year during the annual election period or annual enrollment period between October 15th and December 7th. During this time, one can change a plan for the next calendar year, and I encourage people to evaluate your program each year. As we age, our health changes, our medications may change. The insurance companies that are offering the Part D plans, they can change their plans, deductibles, premiums, formularies. And so it's important to at least do the due diligence and make sure that the plan that you're enrolled in with Part D is the most cost-effective plan for that next calendar year. And there's people like myself that assist people in helping to evaluate those different plan options. One important thing that I should point out that I didn't mention is with the Medicare supplement plan, when one enrolls during their initial enrollment period or special enrollment period, they have what's called a guaranteed issue right. What that means is that the insurance company must accept that person's application in a Medicare supplement plan regardless of health status. There's no health questions asked. They must accept that person's application. If one elects to make application to a Medicare supplement plan and they are outside of their initial enrollment period or special enrollment period, then the insurance company has the right to ask health questions, and it's subject to underwriting approval before the policy is issued. So what I often advise clients, to the best of one's ability, try and choose the plan that you think you want to be stuck in the rest of your life. Because if your health is good, you may be able to make changes in the future. But if you develop a serious medical condition, it's possible that if you wanted to make a change from a Medicare supplement plan to another Medicare supplement plan, or from a Medicare Advantage plan to a Medicare supplement, it could be subject to underwriting approval. Another path that people may take to access care is that part in the center, Medicare Part C, also known as Medicare Advantage plan. These are offered by private health systems and insurance companies, and they're designed to bundle hospital, medical, prescription drug into one plan. And there's numerous Medicare Advantage plans that people may choose from. They're typically set up as an HMO or PPO, meaning one needs to utilize the providers that plan contracts with. Otherwise, they could incur some higher out-of-pocket expenses if they went outside the network. With these programs, there's going to be deductibles and coinsurance, and these plans will vary in terms of what their out-of-pocket exposure may be. Currently, CMS, Centers for Medicare and Medicaid Services, regulate that the out-of-pocket exposure can be no greater than $8,300 annually if you use the providers within that plan's network. With these programs, Medicare Part C, you're still obligated to enroll in Medicare Part B, and will have the premium payments associated depending upon one's filed income. There are some Medicare Advantage programs that will rebate or give back a portion of the Part B premium, and so those are some of the things that you'll want to assess. With Medicare Part C or Medicare Advantage plans, one may not enroll in a Medicare supplement. It is only available to those individuals who elect to enroll in Medicare Parts A and B. If an individual elects to enroll in a Medicare Advantage plan and they decide that they want to change back to original Medicare and with a Medicare supplement, one may do so within the first 12 months of their initial enrollment in the Medicare Advantage plan, and they will still have the guaranteed issue right with the Medicare supplement. After 12 months, your application, if you decide to make a change, is going to be subject to underwriting approval. So that is a high-level overview. Once one understands the timeline as to when they want to enroll in Medicare, then I encourage people, let's understand how you prefer to access care, which path is going to best align with your needs and your preferences. And there's no one size that fits all. Everyone has their own needs, their own preferences, their own budget, different health status, and so it's important that you choose the plan that's best for you, not what your neighbor or well-intentioned family members are telling this works, because everyone's needs are different. I've been assisting people in this area for 44 years, and once I understand what is important to that individual, where their priorities are, then I can look at specific solutions. So with that, I will conclude.
Mm-hmm.
Thank you.
Can we ask questions?
Yes, I'm certainly open to questions.
So it just totally hit me that there's a difference between an Advantage plan and a supplement.
Mm-hmm.
So then, Medicare Part A and B, are there different plans for that, or there's one straight plan for original A and B, and then the supplement are all different from the different Humanas and Uniteds and all of that stuff?
Correct. Good question. Part A and Part B are regulated benefits by Medicare. And so anyone enrolled in Part A, the plan is the same,
Gotcha.
regardless of where one resides in the United States. The same thing with Part B. It is the Medicare supplement plans that vary. There's at least a dozen of Medicare supplement, different types of plans available. The Medicare supplement plans, generally speaking, are going to be the same. So for example, if an insurance company offers a Plan G, that Plan G is going to be the same regardless of which insurance company is offering it. The premiums may vary, maybe customer service may vary and so forth, but the plans are regulated and standardized. With Medicare Advantage, those plans are varied based on how the insurance company wants to design those programs. If you will, CMS puts guardrails out where they say, okay, they must be at least as good as this, and then the companies will establish plan designs that vary, and the networks will vary as well.
Gotcha. So if I only want original Medicare A and B, can I do just that?
You can. The downside to that, and I wouldn't necessarily make that as a recommendation, but you are opening yourself for unlimited financial exposure. As an example, Medicare Part B, following its deductible, will pay 80% of eligible expenses, leaving 20% to the beneficiary. Well, whether you have a $1,000 bill or a $150,000 medical bill, you're responsible for 20%. And either the Medicare supplement plan or a Medicare Advantage plan is going to put a ceiling or a cap as to what your financial exposure is.
Gotcha. Okay.
Any other questions?